one of the primary benefits in using this website is that you can post a case or look at the case whenever you want to, when you're seeking advice or when you just want to see what's going on or when you want to see what people have responded to a case that you've posted. It's very flexible and thus non-invasive. I'm Dr. Stephanie Lee, and here's an example that illustrates how a forum like this can, I believe, actually improve the care of patients who are in very difficult situations. This was a case that was very difficult. It was a patient who was quite sick and who had multiple therapies. And sort of in desperation, someone posted a case showing pictures of this person's skin and asked for help. And there was a lot of discussion about differential diagnosis and various things that this person could try. Eventually, the person who posted the case connected with someone from another specialty who suggested a treatment that, frankly, I had never used before in this case. And she tried it, and then with this particular case, it actually improved the patient quite a bit. So there's an example of where there was a lot of active discussion, a lot of input, and I think we probably helped the patient as well. Here's an example of how the forum can actually provide additional information that a regular email or phone call cannot. In one of the cases that my group discussed on a similar forum, there was actually a patient who had very severe skin problems. And you could have described it, you could have given the size, you could have said the color, but a picture saves you 1,000 words. And just looking at that, I think, was almost like looking at the patient. Digital photography is so good these days that sometimes you actually get more resolution than you would if you were just standing at the bedside. And so in this particular case, it was quite enlightening to just be able to see the picture, and it saved the person who posted the case having to do all those descriptions. So I think this is another example of the power of new technology that is actually improving communications. I think that the true strength of this website is how much information you can provide, including the case, images, radiographs, any other thing that is pertinent to get the best advice possible on difficult cases. That's just very difficult to do, certainly by email or by phone when you're only verbally discussing something. So it's very powerful for that. It also means that you have a record of what people thought, and you can refer back to it, and people can see what other clinicians have said and comment on their comments. And so it's a very interactive process as opposed to what normally happens, which is that people on a one-to-one basis share their difficult cases and their comments, but there really isn't that entire engagement of the community and sharing of experience. I think the forum is very flexible, whether you want to participate as someone who's submitting cases or commenting on cases or just following along. I think it's a very unusual and engaging way of thinking about clinical medicine. You may find it helpful for a particular patient that you're caring for, or you may just want to use it as a learning tool to think about difficult cases and how people would manage them. The nice thing about this website is you can actually see primary data, images, things that help your assessment of the system, of what's going on, so you can provide better advice. So I'm hopeful that what this forum could do is really harness the knowledge of everybody around the world who has expertise in a particular problem and try to deliver that care to that patient no matter where they are.